Hi, Nursing 6818. Welcome to week number 9. This week is your Theory and Behavioral Change Theory week. In this week, you're going to be introduced to and challenged to think of how do I actually use theories and what is the purpose behind them in relationship to an advanced practice nurse and application to care delivery. Your objectives this week are to really learn and understand how we actually use theories from an advanced practice perspective. This week in your clarifying points, you will be working to complete a paper that is due next week, which is your theory and technology paper. Make sure as you're working on this paper that you use conciseness of words. I've been lax in allowing you to have more pages than my requirements or instructions have required. For this paper, I'm really going to be tightening you up because as a nurse practitioner, I need to be able to communicate in as few as words as possible the essence of what I need to get across to another person. So I want you this paper to be concise. Please make sure you're looking at the instructions. We'll go over those in just a little bit. Your outcomes for this week are looking at the different types of change theories and health promotion models and theories and comparing and contrasting them. Why is it this way and why is this one this way? I'm going to ask you to be able to identify or describe the importance of why using a change theory or a health promotion theory actually helps in developing a plan of care for an individual. For checking your understanding this week, do you know the difference between a change theory and a health promotion theory? And the two are different. And once you get the essence of their differences, hopefully you'll be able to see, okay, this theory is going to help me do this with the person, and this theory actually helps to guide the practice of it. So you'll be seeing those come together. Are you able to state the importance of using these theories as you develop care? Can you identify how a theory will assist with the planning for the patient? And do you know how to use these theories to actually guide care? Once you let loose on it's a theory and theories are big and they're cumbersome and they're wonderful ways of thinking, but they're really not applicable. Once you get out of that mindset, if you have it, and you look at, so what is this telling me about human behavior? How is the theory guiding me in understanding how to do something? Health promotion is the how to do something, or how to help somebody or understand somebody. That's the behavior change. It then helps you take away the emotion when your patient doesn't do what you want them to do and you get frustrated with them. So a little bit about them in that little nutshell there. As we move into your readings this week, you're going to be reading chapter 2 in Pender, chapter 10 in Rotman La Fontaine. A different book that I have externally for you is Rain Gruber's Health Promotion Theory section. It's a really good section. There's a lot of information in it. And then in Up to Date in our library. So you will have to access our library site, go to the Up to Date section, and then type in overview of what clinical practice guidelines are. And I want you to read through that. You see, clinical practice guidelines are incorporated into about 75 to 85% of the care processes of what we do and what we're held accountable for from a legal perspective for care delivery, especially when we start dealing with chronic disease processes and maintenance elements. Health promotion and prevention is also one of the elements where we have guidelines that actually take us through, okay, this is supposed to happen for this person at this time, and this happens here, so on and so forth. I have a website called Nursing Theories and Models for you. It's a really nice website. I would encourage you to bookmark this website. And the reason I say that is that when you do your comps, when you're getting ready to graduate, you have to choose a theory to base your care upon, and then you have to explain that theory back to your panel. Well, marking that now, it'll keep it there for you for the future. Also, as you're looking at these theories, I would encourage you to really look at theories that speak to you, that mirror the way your brain works and what your personal belief and value system is. When you align with the theory that way, it makes it easier to use the theory, but it also then becomes a foundation from which you work upon. And when you get asked the question, so how do you develop your care? Oh, I use Orum's theory of self-care deficit, and that's what helps to guide me. You'll be able to say those kind of contextual comments. The National Guideline Clearinghouse is a very, very large repository of where guidelines are located. You have an assignment coming up this week where I'm asking you to look at a guideline to direct your care, so you'll be able to use this website to do that. A reading I have for you is by Simpson. This is a really good article. It actually gives you that piece of the why. Why am I doing this? Why do I have to use the theory? Why do I have to understand them? How do they work for health promotion and prevention? This actually helps guide you into that understanding. So I would really encourage you to just take a peek of it, even skim it, to get that component from it. I put together just a little bit of understanding about why we use the theories and how to use them. You can read that. Your group discussion this week is identifying a health promotion or a change theory that you believe should be used in practice. This is your belief. So you choose your theory and then provide your rationale for your choice. Then the second thing is, how could you use this theory along with motivational interviewing with a resistant patient, and then explain your response. A second assignment this week is called Art and Theory. I want you to really engage the right side of your brain. The right side of your brain is your creative side of your brain, where all the fun actually happens, not the analytical stuff which comes off your left. But the right side lets you go and do fun things. So I want you to choose one health promotion model or theory and draw it, the concepts of the model, the way your brain works with it. I want you to incorporate into that model how you would work with a patient who has stage 3 renal disease and an intervention. And this is what you'll do in your comps, but I want you to just give it a go with looking at the models or the theories that whatever you choose to do or framework, and looking at the concepts of it. What does it look like from the literature or from the source that you're reviewing it at? And then draw it the way your brain would use it. So when you draw it the way your brain will use it, I want you to demonstrate, which means that you're going to have to adapt the model to demonstrate the inclusion of the intervention, and you'll have to adapt the model to demonstrate that this is the patient type. So you are going to work with a patient that has stage 3 renal disease. So there's your patient, and it becomes the beginning of why you want to use that model. So you put that patient in there, and then somewhere along the lines with whatever model, framework, theory you choose, you have to show where you would bring in the art, the music, the nutrition, exercise, or meditation. And you just have to choose one of those. Just choose one intervention. And for art, let's say you decide you want to choose drawing, or you want to choose painting, or you want to do graphic art, or you want to do collage. Whatever your art is that you want to do, that's a tactile piece. You want to bring in music, listening to music, playing music. What do you want to do with the music? Nutrition. Do you want to teach them how to cook? Do you want to teach them how to add more vegetables? Exercise. What kind of exercise? And then meditation. Is this going to be yoga? Is this going to be guided imagery? So define out which one you're going to use. So you need to title the drawing with the name of your theory or your model you're using, and then draw out the model. I need to see in that where you insert the intervention, and at the very beginning that this is your patient type and you're applying this model or theory to that patient type. Now, this assignment could have two purposes. One, you're going to do it here, draw it out. But number two, you could actually use this drawing in your theory and technology paper for the health promotion model that I'm asking you to talk about in that paper. So you could do a dual purpose. You could be drawing it here, and this is your patient type, renal disease, but then you just change that piece out and put in the other piece that's in the paper. So you have a dual purpose to this particular assignment. Have some fun with it. How you draw it and what mechanism you use, if you want to use an art drawing program, or you want to use a Word document and draw it, or you want to actually draw it on a piece of paper with pencils or watercolors or crayons, you can do that and then take a picture of it and then upload that picture to a Word doc and then submit that as your assignment. But you have, whatever you do, you have to be able to have the items labeled that I can see of the model, and I can understand your critical thinking of use for the model and how you are applying it to this particular patient. So here's an example of an adapted health promotion model I put together for you. So this is the health promotion model, and as you can see, I've used nurses as the patients and the experiences of nurses. And if you look at the first column, I've got the factors of the model in here. The second section is the behavior change area. But notice that I've got a big box around everything, and over to the right I have type of exercise intervention will be determined by evaluation of the factors to optimize patient outcomes. So I'm going to be doing exercise as my intervention. And what the rest of it is just the model being put forward. At the bottom of the page, I've got adapted from, where did I adapt it from? So this is an example of how you could put it in here. At the top, I needed to put in nurses with maladaptive behavior, which I didn't put in. But that's what that would be your health problem up here as part of your subconcept. So hopefully that will help you a little bit as you're drawing your maps. This was actually drawn as a Word document, and it was drawn using just the insert of boxes and arrows. And that's all that this was drawn by. It was very simple to do. Your third assignment this week is going to require you to critically reason through a patient's scenario, actually using a clinical guideline, hence the clearinghouse guideline link that you were given this week. So your patient this week is a 41-year-old Hispanic female who comes in for follow-up workup of anemia that we were doing. So what you have are your lab results. So you're going to have to interpret these lab results. And here are your instructions for this. First, you have to identify what kind of anemia that she has, okay, and include your rationale for your diagnosis. So why do you think it is this kind of anemia? Best to best to put a citation here for that. I have a little italicized area. Her anemia is believed to be related to severe menstrual periods for the last 8 months. She does not want a hysterectomy, and she really wants to have more children. She's 41. It's her choice, but we have to use the guideline. So this is put in there because when you start reading the guidelines and you start reading the elements related to them, there's going to be a little controversy here on what would be the best care for her. Identify an appropriate guideline to use to determine her treatment for Joanna. Name the guideline and then give the URL for it. Then we look over that guideline, and in about a paragraph, look at what the reliability and validity of it is. Now you're going to have to go back into the elements that you learned in your nursing research class and pull up what are levels of evidence and what level of evidence is presented for the guideline that makes it reliable and valid to use. So you'll have to go back into past coursework to bring that forward and then identify it. And then I'd like you to outline briefly a plan of care utilizing your chosen guideline. So you know you're going to be using some kind of a guideline that talks about anemia. But we also have a woman who is 41 years of age who wants to have another baby, but who is having significant bleeding with her menses. So we're going to have to do a parallel here of an anemia guideline and possibly in a fertility or a dysfunctional uterine bleeding guideline management. But that'll be up to you. I'm just throwing out some bones to you here. So for this assignment, I do have a format. I want a cover page, please. I want you to use headings for your assignments. So for each of the elements, so what is the type of anemia is a heading, the guideline, reliability, plan of care, and then your reference page. Be concise. Please make sure you cite your work. For your headings, and to help you guys as you're getting ready to write this technology and theory paper, please make sure that you do a left flush heading, and it will be bolded, but it will not be all caps for your heading types. If you have any questions about what you're doing for this particular assignment, let me know. Last piece I want to talk to you about is going over the instructions for the theory and technology paper, which is due next week. I did have students asking me questions while we were on our break, and I've responded to them, and I appreciate the questions that you guys brought forward. So thank you very much for that. I can write things, but my brain is my brain, and your brains are your brains, and my brain and your brain may not always meet when I write things. So I really appreciate your perspectives to help me make the instructions better for you. For the theory and technology paper, you do have to cite things. So for those of you that had difficulty with citing, please make sure you're utilizing the resources that are available on campus. We have a writing center that can help you with writing the paper, citing the paper. This is not a bulleted paper. You must write this paper in a paragraph format with correct APA citation and flow of thought. So the first thing you're going to be doing is you're making your title page. The next page that comes is the beginning or the body of your paper. Please make sure that everybody puts the title of their paper at the very top piece on page number 2. So page number 1 is your title page. Page number 2 starts the body of the paper. When you automatically go to page number 2, your running head and your page number are going to appear. When you begin writing on the page, at the top of the page, underneath the running head and the page number, this should be the title of the paper in normal font, no bolding. And then you start with your heading, which would be introduction to the paper or just introduction. And then the introduction to the paper is written. What I had found when we did our last major paper is that the title of the paper was missing on several students, and I don't want you guys to get those points off again because that is a APA requirement. So the first element after you write the introduction for your paper is going to actually be technology and health promotion, a literary perspective. What you're going to be doing is reviewing the literature. Now, you've had a lot of literature that you've read over the course of this time so far. But you have 3 different things I'm asking you to answer. Okay? Explain how technology can promote and achieve positive health behavior changes to improve the quality of life of a patient with a focused outcome. This must have one reference. And that's specific to that topic. I want to see a reference. Discuss how the programs such as Spark People can be utilized to promote independence in an adult geriatric patient. That's its own article. And then the next piece you have to answer is how can we use Spark People to do cultural alignment or individual cultural needs? And that would be one reference. So for this first section, you will have 3 different references that you will need to find for each of these pieces. Now that will get you a proficient score as well as it's written well. If you want an exemplary, which is the highest score you can get, and you have written good context of information, you have to have 2 articles for each one of these bullet points in order to get the exemplary. Exemplary means that you have gone above and beyond the requirements and exceptionally have demonstrated synthesis of the literature. Proficient means you're able to do it. Being able to do it is 1 article, and that's per bullets in section 1. So I hope this explains it a little bit better. It's kind of hard for me to put that in the instructions like that. So being able to verbalize it too, I hope is being helpful. If you don't understand what I'm asking, please go ahead and contact me and I'll work with you one-on-one. For section number 2, you are going to be explaining how we can use this to address diverse client populations. Think about this as people who live in rural cities and people who live in rural, people who work the night shift versus people who work the day shift. These are different populations. It could be somebody who lives on the East Coast versus somebody who lives on the West Coast. I will need 1 reference to get proficient, 2 references for this section if you want an exemplary and it is well written. The 3rd section is identifying how to use telecommunication technology tools and programs to improve communicating within the primary healthcare setting. Again, you need 1 reference for proficient, 2 for exemplary for this section. The 4th one, identify appropriate health promotion theories. So this is where drawing out that theory in your prior assignment this week will be helpful to you. So you're going to identify a theory, and from that theory, I want you to briefly explain the underlying framework and how it supports technology being integrated as a health promotion part of the plan. And then I want you to identify how this theory supports the nurse practitioner in embodying their role as part of the healthcare team. 1 reference for proficient, 2 references for this section, and it's not like it was in number 1 where you have to have 2 references for each bullet point. This section wraps in itself. So to get a proficient for this section, it's 1 reference for the whole thing. If you want an exemplary and you write this very well, then it would be 2 references, and they must be different references. They cannot be the same reference. So in other words, you used that reference, but you cited Smith & Wesson twice, so you've got 2 references. No, that is 1 reference. You need to have 2 Smith & Wesson 2016, and another reference could be Cat and Abby 2015. So there must be different references to get the exemplary, and that applies to all of them where it says you need 2 for exemplary. So you're going to explain the theory and what it means to you and the parts of it, and then you're actually going to identify how this type of a theory actually supports the role and of you as a nurse practitioner in a healthcare team. Be concise with your words, don't be wordy. The first paragraph under number 4, where it talks about briefly explain the underlying framework, this is going to be a challenge because depending upon what model or theory you choose, it could be very complex. For the more simple theories, this may be answered in possibly 2 paragraphs. If it's a more complex theory, it may actually take you 3 paragraphs to explain this, or possibly 4. As a FYI, a paragraph cannot be any longer than 1 entire page. I'd encourage you, after you write your paragraphs, especially if they're very, very long paragraphs and they're taking up the entire page, go back and read it and look for breakpoints, because it's better to break these up into smaller paragraphs than to have a paragraph run the entire length of a page. just to give you an FYI. Some of you did have that on your last paper, and I gave you some feedback on breaking that element into a different paragraph. So it's best to read them aloud because you also pick up your context of speech. These must be written in the third person. You don't write I anywhere. For section number 4, identifying an appropriate theory in your choice, you can write this author, not I, but this author. And the last section, number 5, this is where your drawing is going to come into play. And then we have the reference page. So this particular paper is taking a lot of the elements that you have learned over the last several weeks and actually applying them into a critical reasoning type formatted of application. If you have any questions about what I'm asking you to do or how to write this paper, please let me know. I hope you guys have a great week. I leave you with this inspirational quote. Only as high as I reach can I grow. Only as far as I seek can I go. Only as deep as I look can I see. Only as much as I dream can I be. This is a hard paper, but you can do it. I have great faith and great trust in every one of you. Enjoy your week.